Welcome, everybody, to the Fasting Transformation Summit, where we are uncovering the most ancient, inexpensive, and powerful healing strategy known to mankind. We're talking about fasting, and I'm your host, Dr. David Jockers, and I'm excited about my guest today. This is Dr. Agolli, and we're going to be talking about fasting in a clinical setting. Dr. Agolli actually really founded one of the largest integrative health clinics in the world, Progressive Medical in Atlanta, and also Dunwoody Labs, which really specializes in functional health testing. You can look them up online. And his clinic has worked with at this point, 35,000, 50,000 patients from literally all around the world, a wide variety of chronic diseases.
And it's our 20th year, so we've had close to about 45,000 patients come through.
Yep. So you have so much experience, and your whole team has so much experience working with people that are looking for health results. And many of them have chronic diseases. Many of them have, serious health setbacks. And fasting is used as one of the foundational strategies. So we're going to talk to him today, really go into that in detail. And so Dr. Agolli, thanks so much for being on the Fasting Transformation Summit.
Thank you, Dr. David. I really appreciate you inviting me for this wonderful transformational fasting summit. And when you and I discussed this well over a year ago, which was your vision, I was excited because I've seen the personal benefits on utilizing different strategies of fasting. And from a scientific perspective, I'd ask myself, wow, is it really possible to get these amazing results that are being reported? And it's just not the functional integrative doctors that are reporting this. We're having doctors from all over the world. I've talked to endocrinologists, I've talked to gastroenterologists, I've spoken to oncologists that were even receptive to utilizing fasting strategies before introducing chemotherapy. And so it's really exciting to be part on the vanguard on utilizing fasting in a clinical setting.
Yeah, absolutely. And when did you first come across the idea that people could use fasting as actually a way to help improve their healing response?
Yeah, probably at the beginning of my medical career, as before I went to medical school, I was involved in traditional naturopathy and nutrition. And, obviously, in natural healing has been talking about fasting. We go back to the days of Hippocrates, who's the father of medicine. And he talks about that in his writings and utilizing the benefits of air, sun, heat, and abstaining from food to heal the body. So that was probably the beginning.
Yeah.
But as I went on to my medical training and education and getting into clinical practice and working with other physicians and other practitioners, it wasn't really brought up that much at the beginning. And it's really made an impact in our practice in the last 5 years. And now it's really making some traction because now we're really seeing that, hey, this is a great tool. It's powerful. We know that there's been ancient studies. Anytime you look at any type of therapy, Dr. David, you want to first of all say, is it safe? And, when I went through a medical training and graduated, the first thing we do is first do no harm. So it passes that test when it's done properly, of course. Another thing that I find it very interesting, it's inexpensive. We're coming into a society right now where, there's a cost factor in every type of therapy that we do. And of course, investing in your health is very important. There's nothing more important than that. And I do believe there has to be an investment on good food, on good supplements, good nutrition, working with very good practitioners, and also making an investment in the proper testing to find out what's happening in the human body. But it's inexpensive, so you can't beat that.
Yeah.
And the key, it's powerful because there are a plethora of benefits that we can talk about. But that's one of the reasons that really piqued my interest. And my role has changed in my organization, and I'm more involved in teaching, business development, administration and management. And I am part of the vision of my organization. And this is a key area that I want to communicate with your viewers today, is that all of our healthcare leaders right now are looking for strategies. And this is probably one of the best strategies, that if we would teach responsibility to our population, I think you're going to see chronic diseases start to go down.
Yeah.
And that's what's exciting for me, is that anybody can use these therapies that we're talking about today with fasting in general.
Yeah, absolutely. And so, how do the physicians that are working and the practitioners and nutritionists, dietitians at your clinic, how do they start to introduce the idea of fasting to people?
Yeah, one size does not fit all, and this
Yeah.
is what we're learning in fasting in general. The strategies that we utilize, because our facility is unique, because we have a team of practitioners, we have medical doctors, we have naturopathic doctors, we have chiropractors, acupuncturists, we have nutritionists, registered dietitians, all working together as a team in concert. And our system is based on specializing in chronic diseases. If you have an acute problem, don't come to our facility. We focus on chronic diseases, which basically means longstanding. And a lot of our patients we're seeing, Dr. David, is they're dealing with a plethora of issues, crushing fatigue, thyroid issues, type 2 diabetes. They're dealing with obesity, which now I call diobesity or inflammobesity, which really there's a connection there with inflammation. There's a kind of a crossover, and I wanted to talk a little bit about some of the adiponectin and these adipokines, which are called leptins, and we'll get a little bit into that because I think it's fascinating how fasting makes a huge impact there. But at Progressive Medical, our main focus is empowering that individual, that patient, on their journey to health. And fasting is introduced at one period of time if they're the right candidate. Now, who's not the right candidate? Well, first of all, I believe that the majority of Americans are candidates for some form of fasting.
Yeah.
But the right candidate is someone that may have a severe eating disorder. We want to be careful about that as well, because there's a psychological component there, whether it's anorexia, bulimia. There's something called orthorexia, which most people don't know about, which is really having this issue with allergies and addicted to that food allergy and just really being OCD about it, which, don't get me wrong, food allergies are very, very important, but sometimes they're sensitivities more than an allergy, and we kind of work on a rotational diet on that. Those individuals, we don't want to really get started on a fasting program. Anybody that's pregnant, I'm talking common sense here, but I don't recommend fasting if you're pregnant, okay? And something called severe cachexia, which we normally see in cancer patient, which is just a severe muscle wasting and degradation. Although cancer's got some great research on fasting, I'd be cautious there. And sometimes we see end-stage renal failure where we may not utilize that as much. But pretty much the rest of the time, we think that fasting done appropriately is a great strategy. At our facility, we utilize it during something called the detox visit, and that's typically the second visit. Their patients are evaluated the first visit. Second visit, we talk about the benefits of an anti-inflammatory diet based on their food sensitivities and also based on some general guidelines. And this is when we're going to start incorporating intermittent fasting. We're really big on intermittent fasting, although there's a lot of great research on the fasting mimicking diet. There's also some great research on water fasting. But at our facility, we focus primarily on the strategies of intermittent fasting. And this is something that you and I have been discussing for a long period of time. There's many ways to do that.
Yeah.
And depending how you educate the individual, let's think about that, Dr. David, fasting. Well, basically, when you eat your last meal and you wake up in the morning and you have breakfast, it's really break fast. So when you're allowing that body to rest, there's numerous benefits. You're resting the digestive system, which is really the key to good health. Gut health is the key to longevity. It's the key to improving your overall health. It's the key to brain function. You know, they call the gut also the second brain, okay? And we're really finding out a lot of research on gut health. So we like to use it in that capacity. It's been very, very, very beneficial to our patients because we're dealing with individuals that, as they start to make lifestyle changes when they come to a facility such as ours, it's a great way to break certain food addictions, which I think is
Yeah.
very, very important.
Yeah, I mean, it's so important. That's for sure. Yeah. And so you were talking about these basically adiponectin and different inflammatory agents as well that are produced by the fat cells. So let's go into that and really how fasting impacts it.
Yeah, it's really interesting because in the early 1990s, I believe it was 1994, scientists made an amazing discovery. Most individuals don't realize that in our fat cells, we call these adipose tissues, that we have something called adipokines. And these adipokines, I'm going to primarily focus on leptin and something called adiponectin. They're basically messengers. They're cytokines, basically, but they're also considered in the same area as hormones, but they're really more of something called a cytokine, which is send these little messages in the body, and they're in our fat cell.
Yeah.
And leptin is one of the adipokines that actually has been known as one of the greatest discoveries to help with obesity and putting on weight loss. Because basically, when you have lower amounts of the leptin, your body is saying eat more, okay? And we're seeing there's a couple of the genetic disorders that with children where they have very low amounts of leptin, and they just have ravenous appetites. They just eat and eat and eat, and they morbidly become obese until they figure out, well, it's these leptin receptors. We also have now found out that there's something called leptin resistance. And so you can have normal levels of leptin. So when you have normal levels of leptin, this basically tells your body you're satisfied and you don't need to eat. When you have leptin resistance, it can be normal, but your satiety is not satisfied. So now we're seeing some really interesting research on leptin, and now we also have seen research on adiponectin, which also sends a message to produce glucose. It's gluconeogenesis. So when you add those two together, those are two key components and how the body's metabolism is going to function on a normal capacity and how the body communicates. And because we've seen an increase in obesity, and I call it diabesity, which there's a connection with type 2 diabetes and obesity. We also seen a connection with inflammation and obesity called inflammobesity. And those two adiponectins play a huge role. Now, how does fasting play a role in that? Well, when we abstain from food, the body goes through transformational changes. And during that time period, you start to get into a stage of feeling satisfied, especially when you're actually staying hydrated. When the body actually is looking for food sources, there's a hormone in the stomach called ghrelin, and that ghrelin actually is telling the body to eat because it begins to get elevated. And there's a correlation with that hormone, and there's also correlations with the adipokines as well. And by actually staying hydrated, you can shut down that mechanism. That ghrelin is being satisfied. So when you start to hear this message, whether your ghrelin is becoming elevated or your leptin is actually dropping very, very low, your body's saying, feed me, but really what it needs is to be hydrated. Yeah. And that's where you're going to start to feel satisfied, satiated. And the hypothalamus is actually not a gland, it's actually a bundle of nerves. And it works as a feedback mechanism. And that's what's so unique about all of these different receptors, Dr. David, is that there's a feedback mechanism with leptin and adiponectin. And adiponectin is so important because that's going to tell the body when to make glucose, when not to make glucose, to turn into energy.
Yeah.
And then we add on that important hormone, insulin. And what fasting does, fasting actually just stops all of that. And when it's done properly, then we start to see our adipose tissue start to shrink. And the way you can measure that, we're starting to see the circumference of a male's waist. If it's over 40, inches, then we're having a problem. And if it's a woman, it's 36. And there's some hip to waist ratio issues, circumference that we're seeing as a great indicator for metabolic diseases. So when we start to use fasting, all of this comes into balance, and we start to see some of the results because we're going to turn that adipose tissue into energy. And we know that after a period of time, we start to burn ketone bodies, and then we start to get the benefits of ketone bodies for better brain function. Our metabolism works more efficiently. And rather than burning those carbohydrates that we're eating, or we're burning when you have too much protein, protein actually can turn into glucose. And even when you have excess of amino acids as well. And the key here is by the proper amounts of fasting, whether it's going to be 16 hours, 18 hours, optimally, the best results that we've seen is between 18 and 20 hours for type 2 diabetes and actually getting those adipokines in balance and really burning the fat. Now, if you start also adding proper hydration, proper minerals, which we like to use a little bit of Himalayan salt or any good sea salt that actually came from a good source. You're getting the right amount of electrolytes. But then you start looking at strategies 2 to 3 days a week on high intensity therapeutic exercises. We're not talking long term here. We're just talking, depending on you as an individual, 10, 15, 20 minutes. And if you do that an hour to two before that fast, now you're exponentially increasing that weight loss, that adipose tissue loss. And this is what's exciting with the research that we've seen at the clinic when you include the intermittent fasting, because obesity is a big problem. Yeah. Obesity is one of the areas that we've seen as, and it's not me saying it, it's the research is saying this. Yeah. We're seeing obesity increase diabetes by close to 50%. We're seeing obesity increase cancer by a high percentage rate. And this is just two severe diseases, and there's a plethora of diseases, autoimmune diseases, we're seeing on the rise. So yes, this is an uncomfortable conversation for some individuals to hear and talk about, that they're overweight. But the reality is, rather than going on yo-yo dieting, which doesn't work, rather than going on a fad diet that doesn't work, rather on taking these dangerous medications that suppress your appetite, maybe short term, that's okay. But long term, we're burning up our receptor sites on our neurotransmitters that are very, very important. And then when you start gorging afterwards, okay, you're gonna gain the weight back. It's called yo-yo dieting. By actually utilizing the strategy of intermittent fasting with a trained professional, or for those of you that are listening to the transformational fasting summit, you're going to get some great strategies. You're going to get some great techniques and knowledge from Dr. David and the team he put together. This is exciting because, number one, when it's done properly, it's safe. Number two, it's expensive. Number three, it's powerful when done right. And my focus is not only obesity, but I really want to talk about obesity because it's an area in our country right now where we're spending all this money, yet we're seeing individuals getting heavier. According to the CDC, certain states, I'm not picking on Mississippi, but it's the number one state. I'm not picking on Alabama. I'm not picking on some of these other states, but now we're hovering close to 40% of the population. Yeah. This is staggering.
Yeah, when you look at somebody that's overweight or obese, they're very energy inefficient. Okay, and what that means is it's almost like, think about it from a money perspective. It's like they put all this money in their savings account. So they've got all this fat storage there, but they're really bad at actually getting in there and using it for energy. So imagine you just put all, 80% of your income in a savings account, but you can never get it out. Okay, that would stink. And so none of us would want that. That's actually what's happening with somebody that's overweight or obese. So when we start to fast, what happens is we start to actually train the body to now go into the savings and utilize that for energy, right? And obviously we start to burn that down, okay, which gives us more of the physique that we want, but also reduces inflammation. Like you were talking about, helps optimize. Loved how you went through adiponectin and leptin, and how it really helps optimize those things. So yeah, absolutely, so key. And you were also saying that in your clinic, you guys are seeing really good results when you do like an 18 to 20 hour intermittent fast. And then did you say exercise kind of like right at the end of that fast before breaking it?
Depending on the lifestyle, of course. We all know
Yeah.
that individuals have busy lifestyles and working. If you can only work out in the morning, absolutely, you need to exercise, because your movement is medicine for the body. I want you to understand that, is that moving is critically important, whether it's just walking vigorously. But yes, the best results we've seen, if you want to really go after a weight loss program, using intermittent fasting, 18 to 20 hours, staying hydrated, okay? And we can talk about having, my pet peeve is having organic coffee and utilizing whether it's MCT oil or coconut oil or grass-fed butter, depending on what you prefer. I like to mix it up in a blender, whether you want to use green tea if you have a problem with coffee, and that's perfectly fine. If you find that you have to have something else besides that, we do talk about bone broth. I think it's okay. I'm kind of a purist. I just want water, a little bit of the trace minerals through Celtic salt, sea salt, or Himalayan salt, and of course having coffee, which also creates a thermogenic response anyway, which is a lot of good research on that. I think coffee's gotten a bad rap. They say, too much of anything is a bad thing. It can affect your adrenal glands, but the body adapts. Or either green tea, lots of green tea, that we have all these polyphenols, and you also have that thermogenic effect. But if you incorporate, okay, right at the tail end, whether it's an hour or two, and you really hit it hard, even though your energy level may be declining, but if you hit it hard with high intensity interval workouts, okay, whether it's going to be on an elliptical, whether you're going to be utilizing a miniature trampoline as well. There's some really good research on that for your lymphatic system. Whether you're going to be adding kettlebells or a little bit, whatever you can do in there to get that heart rate up for a short period of time, whether it's going to be 45 seconds to a minute, we've seen the best results.
Yeah.
We've seen dramatic results. And what's exciting at Progressive is that we actually do a picture. It's called Fit 3D. And that Fit 3D takes a 360-degree thermal picture of the body. And for confidentiality, we just send it to your cell phone if you want to share it with your doctor. But that's also a motivational tool. So we've got before and after of that Fit 3D picture. And let me tell you something. Seeing is believing, because that motivates you.
Yeah.
When you're seeing the circumference. Adipose tissue is that ugly, ugly visceral fat, okay? This is the unhealthy fat. This is what's causing cardiovascular disease. This is what's taking like 600,000 Americans, according to the American Heart Association, are succumbing to cardiovascular disease. It's not just heart disease. When I use the word cardiovascular disease, it's really vessel disease, okay? And what's happening is that obesity and type 2 diabetes is one of the main culprits. It's not only cholesterol. Really what we're finding in the research, it's oxidized cholesterol. It's the particle size of the cholesterol. And that's why I encourage you to work with your doctor to get the right type of testing. And at Progressive and Dunwoody Labs, we believe in really high-tech testing.
Yeah.
I call it Star Trek medicine.
Mm-hmm.
And that's why looking at all these different markers and looking at these adipokines, we test for adiponectin, we test for leptin. We look at all these different cardiovascular markers as well, not just cholesterol. The body needs good cholesterol. The body needs cholesterol. Cholesterol is a transport mechanism into the vessel. That's how it's transporting CoQ10 and all these energies and making all these energies from a biochemical perspective. So there's, one size does not fit all, but I will tell you, by utilizing the benefits of intermittent fasting and looking at how and when you exercise, could make a huge, huge impact. And the research is compelling, as you and I talked about. When we fast for 24 hours, okay, and I recommend for those that can feel adventurous and you're feeling comfortable with fasting, start off small, okay? If you can get to 24 hours, the research is showing that on the 24th hour, you're releasing so much growth hormone, 3, 4, 500% even. And if you added the interval training, it's even exponential. And there's research to back that up as well.
Yeah.
Growth hormone, the master hormone that's released from the pituitary, it's going to make you stronger. It's going to burn body fat. It's going to help your cognition. It's going to tighten your skin. Back in the early 80s, Dr. Daniel Rudman did a study on exogenous hormone from cadavers and brought it into the elderly population. The results were amazing, amazing. So you can actually spare the expense because growth hormone is expensive. You are using injections, and it can also have some side effects that you don't want. By using this strategy with good nutrition, proper amino acids, your growth hormone is going to rise as well.
Yeah, it's powerful, and it creates more resiliency. I know myself personally, this is what I do. So I typically will exercise fully fasted, usually something like 16, 18, sometimes 20 hours fasted. Sometimes I've even exercised 24 hours fasted. And I feel amazing when I'm exercising. I need less oxygen because my body's using ketones as its fuel source, burning fat for fuel. My strength, my stamina, my endurance, all of that is actually better than if I were to be exercising on a shorter fast. So your body creates this amazing level of resiliency. And human growth hormone, a lot of people are concerned about losing muscle mass if they train fasted. Okay, but actually, because you have this spike of human growth hormone, your body's preserving lean body tissue, right? It's actually preserving it. You're going to get a better boost of muscle building afterwards when you consume a really good healthy meal, shortly after you finish exercising. So it's really good.
And that's why it's so powerful. And what our message here with the Transformational Fasting Summit is that anybody can do this. Anybody can do this. It's trial and error. There's so many different strategies. Dr. David has great strategies. You can just start off just simple as 12 hours, and that's really kind of the baby step there. And then you can get into the brunch fast, which is 14 hours, and you get into the next level, and it's 16 hours, which you really start seeing the benefits of it. But I want to mention with some of the patients that we've seen, because we obviously treat more than obesity. I'd just like to mention obesity because that's really the gateway to chronic disease. Don't let anybody fool you that it's okay to be 10, 15, 20, 30 pounds over. It's just not. We got to get back to really preaching good science on how to have weight loss. We got to get rid of the fads. We got to get rid of all these pills and potions that just don't work. And just getting back to really good, solid science is where it's at. But I also want to mention what we do at Progressive is that a lot of patients come in and they want to understand, how do I get healthier? How do I prevent cancer? A lot of individuals are concerned, rightly so. We've seen an increase in cancer. When President Nixon actually had his second term inaugural speech, he talked about declaring war on cancer. And that was back in 72, 73, I forget exactly when it was. But at that particular time, we actually had 1 in 7 Americans were getting cancer, and they were declaring war. And I can just tell you right now, as a former proud military person who served the United States Air Force, I can tell you when the military goes to war, they go vehemently with great force. So we did that as a country, but where are we today with cancer? We went from 1 in 7, now we're actually 1 in 2 with males and 1 in 3 with women in their lifetime are going to get cancer. So where's all this research going? And we have to understand that cancer is a multifactorial disease process. There's genetics involved, which is really more epigenetics. We now know that there's environmental components. We're seeing an all-time high of chemicals, which I believe probably is one of the main reasons why. We're seeing a decline in our diet. We're seeing devitalized food. We're seeing food that's loaded with chemicals, GMOs. I call it the Frankenstein food. All of this plays a role. But one of the best ways to combat against that is to detoxify the body at the cellular level. And at Progressive, this is what we talk about. If you want prevention, learn strategies to detoxify. Now we have colon detoxification, which is very important, I believe, too. I'm not talking about that. We also have food detoxification programs, and we have phase 1, phase 2 liver detoxifications, which is all wonderful, don't get me wrong. But without utilizing the benefits of the intermittent fasting, you're going to fall short. Why? Because of a very simple word that Dr. Jockers and I have been studying. It's called autophagy. And that word basically means intracellular degradation. Yeah, your cells can clean themselves up. Your cells can actually clean up that cellular debris. How? When you fast, that mechanism turns on autophagy, and we're getting rid of the bad cells, and we're making new cells. And this is what's exciting about benefiting from intermittent fasting. Yes, weight loss. Yes, better clarity. Yes, we can have more growth hormone, feel stronger. But really, the key is to clean that cell up one cell at a time. And we've got trillions of cells, 100 trillion cells is what some scientists are reporting. And these cells communicate together. And when they don't communicate, it's like sludge. One of the best examples I can give, for those of you that have ever been down to Florida, I lived in Florida for about 15 years, and I would drive down from Fort Myers to Fort Lauderdale and go down Alligator Alley. And let me tell you something. You know what you see? You see the swamps. And that swamp is sludge. I can't see anything. Yet, when I went to visit the Colorado Rockies and I watched the water, it's pristine. Why? Because it's flowing and it's communicating and it's pristine water because it's moving, flowing. This is what your vessels need. Your blood is the river of life going through the cells. And we need to have good, healthy blood transporting all those oxygen and nutrients from one cell to the other. And fasting can do that, Dr. David. And that's why I'm a big believer in it, not only personally, but professionally. And that's what I'm really excited to share with our viewers today.
And so how do you personally apply fasting? What kind of strategies?
I've tried different strategies as well. And I find the best strategy for me is 5 to 6 days a week. I have to rest on day 7 as God told us to rest on a day on the Sabbath. And I really do it because my wife wants me to eat with her earlier. So that's really for her. Otherwise, I do it all the time. But I go anywhere from 16 to 24 hours. Pretty much 18 is the norm for me, 18 to 19. I do try to get in a 24-hour fast at least once every 7 to 10 days to get that growth hormone release. I did sustain a very serious injury over the summer that I had a wound when I was traveling in Europe. Unfortunately, I couldn't work out. But by maintaining my fasting lifestyle, I didn't gain any weight. I felt strong. And now I'm back working out for the first time after 14 weeks of recovery. And I'm feeling really good about it. And I have to say that because, when you're injured, you feel depressed. You're not moving around. You feel sedentary. You feel lethargic. And I'll have to say, because I really was very concerned with this injury, thinking that I may start to gorge and eat because we all develop this ravenous appetite because of ghrelin and leptin resistance. This is why we're feeling that way. And it was wonderful that I can say that I didn't experience that at all. It was fascinating. I did take some time to heal, but I think that the fasting really expedited that process as well. It could have been a lot longer, it could have been a lot worse. I've had several of my colleagues say easily could have lost part of my foot, which is great that the advances of medicine helped me with all the other therapies as well, with the hyperbaric and the ozone and all that stuff is wonderful. But I have to say, what really kept me in tune was the fasting.
Yeah, that's powerful testimonial. Well, this has been a great interview, Dr. Agolli. Any final words of inspiration for our audience here as they look into fasting, as they're listening to these interviews and being inspired to move forward with a fasting
well, first
lifestyle?
of all, I want to thank you for sharing this opportunity. I just want to encourage the listeners out there. As I mentioned earlier, obesity, all-time high. Type 2 diabetes, all-time high. Chronic diseases, autoimmune diseases, cancer, all-time high. I just want to speak to the cancer population. Dr. Walter Longo at USC has done some great studies. if you're doing chemotherapy with your oncologist, I encourage you to listen to your oncologist, but also encourage you to do some research. Dr. Longo has it where you fast for 48 hours before chemotherapy. It actually mitigates the side effects by almost 50%. That's 50% less damage. Why? Because when the body is fasting, the cells start to protect themselves. And so all of the cells that usually would be damaged, the good cells, by chemotherapy are not. So just incorporating that. For those of you that want to prevent cancer, well, obviously this is something we all want to do. Prevention is the key. Okay? An ounce of prevention is worth a pound of cure. Fasting may do that. I can't sit there and say to you that if you intermittent fast, you won't get cancer. I can't sit there and say to you, if you intermittent fast, you're not going to. No, I'm not saying that at all. But everything that you can do to prevent all of these diseases are to your advantage, because the goal here is to live a long, healthy, functional life, not just a long life. Okay, a lot of individuals right now with the advancement in medicine can live a longer life, but are they living a functional, thriving life? And I'm just going to say they're not. And that's why I want to encourage all of you to look at these benefits of intermittent fasting. I've seen it myself at our clinics, our practitioners, working alongside healthcare leaders and visionaries such as Dr. David Jockers. Fasting is here to stay. It's not a fad. It's been here for thousands and thousands of years that we've documented. Tap into that research that God has given you the innate ability to cure yourself one cell at a time. No doctor can cure you. No therapy can cure you. Your human body has the ability to heal itself. And the fasting, whatever you decide to do, water fast, intermittent fasting, not have food, many strategies. And that's why this transformational fasting summit is going to help you get on the road to wellness.
Well, thank you so much, Dr. Agolli. Fasting has the ability to unlock the dormant healing potential within you. It's safe, it's powerful, and it just might transform your life. Thanks so much for tuning in with us. And if you're getting a lot out of these interviews, I just want you to consider owning the entire Fasting Transformation Summit for yourself. That way you have lifetime access to all the videos, the audio, as well as the transcripts. You can go through that. We also have a ton of bonuses that you can take advantage of. So if you would consider owning it, we would really be blessed and honored by that. And so we'll see you on a future interview. Be blessed, everybody.